Methadone, by federal law, someone has to get it from a methadone clinic that's licensed with the DEA and very, very heavily regulated. Patients have to go in every day when they start on a program. Most programs are open 6 days a week. So when they start, they have to go in every day, and then every 3 months that they're doing well, they can earn what's called a take-home. That was pretty much what we had from the early 70s until 2003. And then in 2003 is when Suboxone became available. So buprenorphine or Suboxone, the combination of buprenorphine and naloxone, can be prescribed by a doctor, and then the patient can go get it at the pharmacy. So it's different than methadone. It's also different because methadone is a full opiate receptor binder, whereas buprenorphine is only a partial. So a lot of people, because of that difference, look at buprenorphine differently. So the initial law from 2000 specified physician. The CARA Act that just passed this fall has a provision in there for nurse practitioners and physician assistants to be able to prescribe it. The regulations for that law have not been completed, so as of now, they can't. About going on 15 months ago, I think, a program in Hagerstown called the Wells House. And they had a physician who was prescribing buprenorphine there, and he retired, and they couldn't find anyone in the area who was willing to do it, so they asked us if we could do it, and it was kind of far to drive, so we were trying to do more using telemedicine, so we decided that we would do that. And we see them just as though they were in the office with us, but we see them, using a camera and a computer screen. And we get records from the clinic ahead of time. Obviously we can't do a physical exam, but we can see the things that we need to prescribe Suboxone. If somebody's in withdrawal, they might be sweating, tearing, runny nose, their pupils are often dilated, and the cameras are good enough that we can see all of those things. So it actually works pretty well using the telemedicine.
I had so many racing thoughts at the time, but the very second he introduced himself, I felt that the complete ease. I felt complete ease. I felt like that it was okay. It was okay, and it really is.
That was the first time I ever seen a doctor on the screen through the television. It was cool to me, but it's also something new. But Hagerstown is so small, and there's so few Suboxone doctors, and a lot of doctors don't want to go take the class to get the certification to be able to prescribe the Suboxone. It's sad because addiction is worldwide everywhere.
The physician has to do an 8-hour training. Again, this is in the law that it specifies an 8-hour training specifically on how to use the medication. Those of us who have done either through addiction psychiatry or addiction medicine extra training and have extra certification, we're allowed now to have 275 patients. The fear is, because there are pain doctors who have 1,000-2,000 patients that they really can't provide adequate care to. That's the reason that the number is there, to try and prevent people just having tons and tons of patients that they really can't monitor and provide good care to. The problem is that there are hundreds and hundreds of doctors in Maryland who've done the 8-hour training and are allowed to prescribe Suboxone. But many of the doctors, they only do the training and then they never actually use it, or they use it for 1 or 2 patients. It's a constant problem of how can we get more doctors doing it, and how can we get more of the doctors who are already able to do it to do more of it. And it's even a shortage here in Baltimore City, but it's certainly a shortage out in a lot of the more rural counties. Certainly this new law that allows us to have more patients is a good thing. But it doesn't solve the problem because most of us that do this do other things and so can't have 275 patients. I think if anyone is struggling or they have a loved one who's struggling, I think the state is trying to do more to work with local health departments, so it may take some persistence, but I think, and certainly if you even call right directly to the Behavioral Health Administration at the state, they will help somebody try to find somebody where, where they live that can help them.
You gotta want this thing. If you keep calling and somebody will pick up that phone and help you.
So many people are trying to get help that it's just hard to find a spot somewhere. And I believe that once you find a spot, that you have to do the right thing to hold on to it, because you have to keep in mind how hard it was to get you that point.